Okay, so, when we're talking about this whole comparison, let me also ask you about the other side of that. You're talking about how people have to use different things in order to avoid the downside of it. So does Suboxone, which is what's used by most medical doctors in drug diversion programs, does it also work as a palliative to get you off of these two drugs, heroin or Oxycontin?
Absolutely.
So,
absolutely.
Could you talk a little bit about that? Because that's what people really want to know. What can you do if you got a Jones to fix that shit?
Well, what you do is, first of all, you have to know that you are ready to stop. It doesn't make sense to do it over and over and over again, stop for a while, 2 weeks, and then go back on it, and then stop for a while for 2 to 3 weeks, and then go right back on it. It's easy to fall into that cycle. But Suboxone will stop you from being sick.
Is it the physical sickness more, or is it the...
Bang, you feel like you can wake up, like you actually do that, and you can walk through the day like you haven't did in years, feeling like a completely normal, sober person. So
Suboxone, you told me, is what we need to see used instead of methadone.
I would say so. Some people like to say that Suboxone doesn't work on them. They're full of shit. They just want to keep getting high.
Wait a minute. Let's go back there for a second. Now, you're saying that in your experience, personal experience, that these, from what you know, that these people are lying when they say that Suboxone doesn't work for them?
And they lie to themselves, or they lie just for the sake of lying, or they want to rather do some drugs, But I've never, they've always worked with me. And I see people that if they actually let the damn things do what they're supposed to do, they'll work.
So you can, just like you could buy Oxycontin and heroin on the street, you could buy Suboxone.
Anything a doctor prescribes, you can buy.
So if you're wanting to get off of drugs, instead of buying Oxy, you could buy Suboxone.
Right. And Suboxone.
Suboxone.
Yes.
Now, if you start taking it, how long does it work? And if you start taking it, what else do you have to do to stay off of the drugs once you've taken the Suboxone?
Once you take the Suboxone, you can just go about your time in the last 24. One pill will last you 24 hours.
So you take Suboxone for, say, a week or 2 weeks, and then after that you really pretty much lose the craving?
Truly, you won't quit. You can do it as little as 5 days.
You could actually use Suboxone in 5 days, and you could kick heroin or Oxycontin. And you could buy it right on the street from the same people probably that you buy the other two from.
Sometimes you can, but it depends on different people tell different things. There are people that actually want to get off that shit, and they don't mind selling it to people that's trying to get off of it.
And
so you can take it and drink beer and stuff, and some people get buzzed off of it. Some people start using them to get buzzed off of it. After a while, you're not going to get high anymore once your body adjusts to them. You ain't getting high anymore. Because
it's a neural blocker. Suboxone, for those who don't know, blocks the neural pathways to the dendrites that give you the get high feeling. They shut down your get high center.
Yeah, don't get the Suboxone. You're just wasting your time.